Welcome back to E-News. Today's topic is infectious diseases. We'll be discussing the common disease that has been wiping out many people around the world, dengue fever. Dengue, also known as breakbone fever, is a viral infection that spreads from mosquitoes to humans. Dengue fever can be caused by any of four genetically related but antigenetically distinct dengue virus, dengue stereotypes, dengue 1, dengue 2, dengue 3, and dengue 4. Dengue virus is spread largely by the bite of an infected mosquito. Female mosquitoes acquire DENV through a blood meal from viremic humans as the major host and source of virus.
Signs and symptoms of dengue fever. There are many different signs and symptoms that are associated with dengue fever. Some of the most common signs and symptoms include headache, nausea, vomiting, fever, redness, and pain in the eye, sore throat, pain in the bones, joint and muscle pain, dizziness, rapid pulse, rash, and bleeding tendencies.
There is no specific treatment for dengue fever. However, drinking plenty fluid and taking medications like Tylenol can help relieve symptoms. In addition, dengue fever can reduce platelet count in humans. Consuming papaya leaves extract can help increase it. If you have severe dengue fever, you may require the following: fluid and electrolyte replacement by intravenous, monitoring vital signs, paying closely attention to blood pressure, and blood transfusion to compensate from blood loss.
How does dengue fever affect our global population? According to the World Health Organization, they report that dengue is now an endemic disease in over 100 different countries. Dengue endemic regions are home to up to 3.6 billion people, or 40% of the world's population. Dengue virus is thought to infect 400 million people annually, cause illness in 100 million of those affected, and cause 21,000 fatalities. This diagram shows the number of dengue fever cases from 2010 to 2022. In 2010, there were about 1.7 million cases. 2011 to 2012, there were approximately 1 to 1.3 million cases. In 2013, there were over 2 million cases. In 2014, there were about 1.2 million cases. In 2015, over 2.5 million cases. In 2016, there were over 2.9 million cases. In 2017 to 2018, it decreased to just under a million. In 2019, it spiked to its highest peak to over 3 million. In 2020, there were over 2.5 million. In 2021, there were about 1.4 million cases, and in 2022, there are about 2.9 million confirmed cases. Minister of Health and Wellness, the Honorable Dr. Michael Darwell, said the public should be aware that the Department of Public Health teams in New Providence and Abaco are actively monitoring 16 positive cases and family members with dengue fever. Additionally, we are working with the Department of Environmental Health Services to ensure that usual standard vector control protocols remain in place to reduce the spread of all airborne virus illnesses like dengue within the country. Mosquitoes that spread dengue fever bite from dusk to dawn. Prevent mosquito bites by staying indoors during this time. Other ways you can prevent mosquito bites by putting screens by your windows and doors in your home and draping mosquito nettings over beds. Apply insect repellent to exposed skin only. Do not use underclothing. This will help mosquitoes to stay away from you. If you are going outdoors, wear a long sleeve shirt and long sleeve pants. This provides a barrier between your skin and the mosquitoes and prevent the spread of dengue fever.
Make sure to empty water out of cups, bags, buckets, or anything in the yard that can hold water. This provides the perfect breeding grounds for mosquitoes to lay their eggs. Remember to stay healthy, stay safe, and stay positive. Until next time.